Hi, everyone. On today's podcast, we're joined by EBB Childbirth class graduates Rivka and Stephen Dubinsky as they share their journey from a traumatic first birth to an empowering second birth experience. Hi, everyone, and welcome to today's episode of the Evidence-Based Birth Podcast. I am so excited to have Rivka and Stephen on to share their birth stories. Rivka is an accountant by trade and now a stay-at-home mom to her two children, Yehudis and Sarah. Rivka and her family live in Columbus, Ohio, where Rivka enjoys embracing the joys and challenges of motherhood while staying connected to her passions. Rivka has a deep love for advocacy and believes in empowering others through knowledge and support. When she's not busy with her little ones, she loves creating and cultivating new things, whether in the garden or through hands-on projects. Stephen is a dedicated nursing home operator who is passionate about providing quality care for the elderly. With a commitment to ensuring that residents receive the best possible support, he works to create a compassionate and well-run environment. When he's not managing operations, Stephen enjoys spending time with Rivka and their two children at their home in Columbus. Rivka and Stephen are here together to share their birth stories, and they hope their journey resonates with and inspires those of you who are listening. Rivka and Stephen, welcome to the Evidence-Based Birth Podcast.
Thanks. We're happy to be here.
So, can you tell us a little bit about, your first birth experience and how that kind of set the stage for everything that happened later on?
Yeah, definitely. So our daughter Yehudis is 7 now, so we have a decent age gap. We lived in Florida when we had her, and we kind of just went into everything with a lot of trust in the system, and everything was just gonna work out well, because why wouldn't it? I'm from a big family, been around lots of babies, never at a birth before ours, but familiar with the concept. So she was not going anywhere. She ended up being a 41-week induction. The day before my induction, my doctor said she's sunny side up. If she's still sunny side up when it's time to come out and she's not movable, then that's an automatic C-section. That didn't end up happening, but that's kind of what was in my mind. And it was even in the pre-arrive days. That was in 2017. So in my mind, induction meant I'm probably having a C-section, and that kind of set the groundwork. Then when we came in for the induction the night before, immediately hooked up to an IV and continuous monitoring all night. And I had Cervidil. Then in the morning, they started the Pitocin. And pretty much from that moment, after they turned on the Pitocin, the nurse said, okay, so now if you need to go to the bathroom, I'll bring you a bedpan. And you're pretty much in the bed from here on out. And I wasn't expecting that. And no, they didn't tell me that beforehand. I didn't know what I could advocate for. So that was kind of the majority of, my doctor came in, broke my water without telling me what he was doing. Eventually, when it was time to push, it was very quick. I only pushed for 20 minutes, but I had an episiotomy that didn't tell me about beforehand. Immediately, she was taken to the warmer there for 40 minutes. Again, her APGAR was like 8 or 9. So there wasn't really a medical reason that I can think of. Maybe initially there was meconium in the waters, but I don't know why she was there for so long. And I didn't know that, I assumed that they were going to bring her to me as soon as she could come to me. So I didn't say anything. So that's pretty much the birth story. And then just to add to the complexity, my father was sick at the time. She was 2 months old. He went into a coma and then died when she was 3 months old. So kind of a lot went on. The last, I guess, important piece is, I don't know if it was from the episiotomy or from the tearing or both, but I had nerve damage that never went away. And I've done all the things. I've seen every pelvic floor physical therapist that exists in this area. I've seen the specialists. So at this point, it just is what it is. But that definitely added to, I guess, how I feel about my experience after the fact.
Mm-hmm.
So
it sounds like it was a pretty traumatic experience. Did you always
yes.
view it that way from the beginning, or did it take you a while to realize?
No, it took me a while. It took me years. When I was in therapy for other things and we were talking about medical trauma, and I was saying I didn't really think I had any, and then we kind of went over my birth story and discovered that I had a lot of it. something I struggled with was, how can I call it traumatic? I didn't bleed out. I didn't almost die. My baby was healthy. Like, everything was fine. There were no medical complexities. But then I joined a couple of like birth trauma Facebook groups, and I saw that probably 95% of the posts started with, I know what happened to me isn't as bad as what happened to anybody else, but, and it didn't matter if they almost bled out or if their story was more similar to mine. So that was kind of eye-opening to me, that
So
trauma
everybody was
is,
kinda like
yes,
downplays their what happened to them as not being that bad.
exactly. It's really just, it affects you and your experience and really not compared to anybody else's experience. So
Steven, what about you, going through that first birth experience? What was it like from your end?
We were very young. Uh, we were also, newlyweds. I think we got pregnant within 6 months of getting married. We got married within 90 days of meeting each other. I think there's a show we could have been eligible for. Um, but it was all very, we really just didn't know what to expect. I think even, like we said, through the years after the birthing story, after the birth, we didn't really realize that her being, bedbound for no reason, and her, not having the option to drink or eat at once that kicked in. I think, my biggest regret was really just not knowing enough to advocate for Rivka. And we had a doula who, maybe I just assumed that doula would be the advocate, and I was kind of just there to, you know, I don't know what the hell really I was doing there, but I think really my biggest regret is not knowing enough to be the support that Rivka, needed.
It's like you didn't know what you didn't know.
Yeah, I mean, I,
So
I wasn't pushing anything out. I was having a good time. I think maybe I had a couple shots in me or something. I was just having a good time. I don't think I even understood the severity of what was happening, and the different ways in which, knowing what I know now, I should have been there. So for me, it really was just, it's amazing. It's a great time. And, the doctors are going to be professionals and make sure that whatever's going to happen is going to be, to Rivka and the baby's, betterment, which, as we know now, a lot of things could have happened differently, but, we were young, and it was our first, and we just really we weren't educated.
And to be perfectly fair, we did have a great time. And there was a lot of laughter. We were joking through pushing, like, we did have a great time, and that's part of why it took so long to really process what happened. Neither of us really just knew what could be different, so it wasn't.
mhm. Yeah. And was there anything as you started processing your birth that really stuck out at you in terms of, was it having your autonomy taken away? Was it the interventions or the nerve damage? What was it that seemed to be like the hardest part for you to
Yeah,
process?
number one is the lack of autonomy. Number two was the nerve damage, the physical outcome that, I guess, the birth injury. I never
I
really,
would say number three would be the baby not being on you right away.
honestly, that's right up there with number one, the autonomy and her being separated from me for no
And
reason.
it kind of goes hand in hand because,
Yes.
yeah, you weren't prioritized as a family. It was just about the medical procedures and getting things done, it sounds like.
Yeah. I'm
Mm.
really not, I didn't go into it wanting a natural birth. I've got no problem with medical interventions. You'll hear from my second story. Medically, it wasn't that different, and the whole experience was the opposite. So that I did not do, like a real birthing class or anything with the first. That the interventions were not the problem. In fact, I've had surgeries that were less traumatic because I knew going in what was going to happen. I basically woke up to pictures in my inbox from my doctor of everything that was done, and I have no sense of violation from any of that because I knew going in, I knew what the plan was, and then he let me know all the changes and why. So it really wasn't the fact that birth is a vulnerable experience or anything like that. It was the actions that were done to take away my autonomy, not really give me a voice in the process that I didn't know I needed to fight for.
Right, and then the nerve injury was
It was just
probably a direct result of not consulting you
I
and
believe
protect
so, because the 20
yeah.
minutes of pushing, like, what was the episiotomy for?
Right.
Nobody can pinpoint exactly what went wrong and therefore what caused it exactly. But
Mhm.
I mean, I have my suspicions. I read 200 pages of medical notes.
And where in Florida was this first birth then?
Miami Mercy
Okay.
Hospital.
Okay. So tell us then what happened next, because you said there's a bit of a gap between your two children. Can you talk a little bit about that?
Yeah. So for starters, I wasn't even sure if I ever wanted to go through that again ever. So that was a big part of it. It took me a while to like bring my head around like maybe this is something I can do again. And once I got to that point that like we wanted another baby and the only reason we weren't trying for that was really my fear, I started interviewing doctors. I think I met with 5 and across 3 different hospital systems. And in that process, I met Allie, who was my evidence-based birth instructor. And she helped me like with my lists of, I think she added a couple names and took some off for me. And she also helped me talk me through the hospital systems, which I think is a really big piece of it. And when I told
And
her
was this
everything
still
I
in
wanted.
Florida or is this
No,
in
so this
Ohio?
so this was after we moved to Ohio. So we moved to Ohio
Okay.
when our first was a year and a half. So a whole new place, whole new culture. And I told her kind of what I was looking for. And at that time, I was planning to have a C-section. I wasn't going to do a vaginal birth ever again. Nobody could say why that happened, and therefore I wasn't going to risk it. So I had my list of like, this is what I want in a C-section. And also trauma-informed care was extremely important to me. So so she said, St. Anne's, that's the hospital you need to be at. So I met with a bunch of doctors, and there were 2 that I really liked. One, I knew his office was going to drive me crazy every time I had to deal with them. And the other, like her practice was really universal. Like the trauma informed care and like the respectful care was across the board. There were 2 women OBGYNs. They covered all their own call. And the biggest thing when I asked her what I would do, I would come in with my list of like, this is what I want. Will you support a maternal request C-section? And can I have these things? So I asked her that question and her answer was just yes. She didn't have to like, some of the other answers I got was, yeah, we'll counsel on risks and benefits. We'll have that conversation. Oh, hearing your story. Yeah, I see why you want that. Okay. It was just, straight yes. And then we obviously had the conversation and I told her my story and we talked about the risks and benefits, but like just her gut response is, yes, I support what you need. So that was a really big.
Shout out to doctor.
I don't. Can I say her name? Is that? I don't know. Dr. Angela Rouse. She's amazing in every way. And then it took a while. We didn't get pregnant right away, like we did with our first. So we ended up needing fertility treatment. I don't know. With our first, you get pregnant and then you don't see your doctor for like 8 weeks. So I remember like thinking, am I really pregnant? Maybe I imagined it. Do I need to pee on another stick? But I was having ultrasounds frequently and blood work and more blood work. And, I figured out if I drive to the hospital that's a little bit further from my house, but then by the time I get home, I'll have results within 10 minutes instead of having to wait another couple hours. Anyone who's done infertility treatment will, resonate with those things, I think.
And then what did you go about doing differently with this pregnancy than to educate yourself?
For starters, I had the doctor I chose, and then also in the back of my mind, I had several other doctors that I was technically a patient of, but I didn't tell them that I wasn't actually establishing care. I was just interviewing them. So I figured if for whatever reason I hate her or I hate their office or something not a fit, I have options. I can switch and it won't be as complicated. And that didn't happen, but it kind of helped me feel safe going into the process. And I'm kind of an information junkie, Stephen calls me sometimes. So when like I just read everything and learned everything and tried to find out what my options would be so that I felt more prepared going in.
Mm-hmm. And so learning is like a hobby of yours.
Kind of, yes.
Yeah. I totally identify with that.
It's sort of passive. Like I don't set out to learn, but if there's something I'm interested in, the information just finds me. Yes, I have spent several hours reading, so it's not, but it's not, I don't work at it. It just comes to me.
You just absorb it and soak it up.
Yes.
Yeah. So how did you find out about the evidence-based birth childbirth class or EBB in general?
Yeah, so I started interviewing doulas, and then I reached back out to Allie also because we'd had been in touch before. And she offered 2 classes. One was evidence-based birth and one was hypnobirthing. And I was not in like the frame of mind where I could consider something like hypnobirthing. I didn't believe in birth, like, or any of those things. I feel like you need a lot more trust than I had. But I felt like evidence-based birth more, it was something I could be more open to than some other form. That's kind of how I chose it. Yeah, I interviewed a few doulas, but to be honest, the ones that I really felt like would be a good fit for me, it was cost prohibitive. And the value is there. It's not that I don't think it's worth it, but I also had a difficult postpartum experience. And when I looked at the money that we were going to be spending, what a labor and birth doula was pretty much the same as 4 weeks of twice a week overnights. And I prioritized postpartum in that sense. So we did not end up hiring any of the private doulas that we interviewed, even though there were at least 3 that I really would have wanted to, but we just didn't go that route.
But you still had contact with your EBV instructor and were
Yes,
able to
and
catch
she
up with
was
that.
really helpful with everything, and she looked over my birth plan, and she really talked me through it. She suggested some other options. So
And then we also took that course to really put me in that spot to step up there.
right, and yes, and the advocacy lesson, I think, was the one that you took the most seriously. Really put it into practice.
Yeah, Stephen, tell us a little bit about that. Like, what did you learn either about childbirth or about advocacy or partner support that you
I think the
were
most
excited
important
to
thing
use?
was getting a clear understanding of what Rivka's wishes would be if she's not in a position to make a decision. And so getting a really clear basis of, how can I act in Rivka's, stead if she needs me to. So just, sitting down with her and going through her birth plan and going through scenarios with her and, getting her 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10 list of very important things that she wants to make sure happen. So just sitting with Rivka and making sure I have that clear. And then it's just, getting prepared and making sure that I know that I can in the moment, hey, everyone stop, or, make sure that I'm in a position where I'm gonna step up in that way for her. Mm. And I think we had a really good time with it. It was a very positive experience. We actually signed up for like the on-call doula.
So the hospital has a doula program where it's subsidized, but you only get whoever's on call. And I had talked to the coordinator, and she made it seem like she could shortlist specific ones that she thought would be a match for me, but
She tells everyone.
I was right. It didn't happen when it came down to it. Joe, you can take it from here.
Yeah. So I think we were probably, was it maybe like 12 hours into it by the time?
No, it was only like 5.
Okay. Seemed like 12 or 30. We were like 5 hours into the, the birthing process by the time the doula showed up. And we were just like in a zone. We had like a good playlist going. And we were just like in a really good zone. And a doula came in who I think maybe wasn't as, seasoned of a doula. She came in with like very doula-y energy. I don't know if that exists, but I think it does. And she was like, let me give you a massage. And Rivka's like, okay, yeah. Like Rivka was like, I could sense very clearly, almost like appeasing the doula instead of being.
I was entertaining her.
Right. And I could just sense that like the energy in the room had shifted from when the doula got there. She was maybe there for like 45 minutes, and Rivka, as she was dealing with this birthing process, was getting up and walking around and going to the bathroom. So Rivka went to use, I think you just kind of wanted to like get out of that like environment.
Yeah, I'm pretty sure that was the excuse. I went to take a shower, but I think I just needed a break.
So I went into the shower room with Rivka and I said, this is not working right with this deal. And she's like, yeah, I really just, I'm not feeling it. And I said, you need to just, cut her loose. And Rivka said, yeah. So Rivka stayed she didn't like, it was awkward, obviously. So Rivka stayed in the shower room. I went out and I went to the doula and I was like, you are so great. And we really appreciate everything, but we got it from here. And she was like a little confused. And I was like, You got to go. So the doula, I mean, she wasn't getting it. So I was like, thank you, but we got it. We're going to be going in another direction.
Very said that.
And so she got it. She took the very obvious hint. And then the nurse was like, did you just fire the doula? And I was like, unfortunately, we had to make the decision that best fits
I
our
mean, I
needs at the
think
time.
that is one of the drawbacks to kind of that on-call doula. Like I'm sure in many situations it's very helpful, but if it's not the right fit, you don't already have a trusting relationship with them. Like it's not
Yeah,
a
I mean,
good
your
fit
luck of the draw, and I'm sure
energy-wise.
for someone else, she would have been a fantastic fit for them. And
Right, but it
and
just
she did
wasn't
have an
right.
energy that I think some people would like, but I think we were already in a zone where, like, I think what Rivka needed, I was giving her. Thank God, I was,
Right.
we were very prepared and very intentional, and that really was the plan. We kind of almost had the doula as like a bata.
I had very specific needs. I was really scared that similar things would happen and that I would not be able to find my voice and that he wouldn't step in and be it. So that's really what I needed. I wasn't looking for all the pain relief options. I wasn't looking for hands-on support. I didn't want any of that. Maybe if it was somebody who I already had a connection with, that would have been welcome. But it just turned out that I voiced the whole time and he was there to step in whenever I didn't. So I didn't need another person and it just interfered with our flow. So
Wow, that just gave me chills when you said I had my voice the whole time. That's amazing. Can we rewind a little bit because you you were telling me, a few minutes ago that you were planning like an elective
yes,
cesarean and now we're in a vaginal birth story. So,
yes.
what shifted? What kind of birth were you planning and how did those changes take
Okay,
place?
so my doctor, he discussed every single option for every single kind of birth ad nauseum the entire pregnancy. She was so patient and had no problem going through things again and again and again. And what she kept telling me was, we're going to plan for whatever you want to plan for. And I think that your gut is going to tell you what you want to do. So we will discuss all the risks and benefits. We will talk about all the statistics, but your gut is going to tell you what you want to do at the end. And that's what happened.
Mm.
So she said at 24 weeks, that's when the schedule opens. We'll schedule your C-section for whatever you want. If you want it 39 weeks, if you want it 41 weeks, whatever you want. So we scheduled it at 41 weeks because at that point, I just didn't want another induction. That's where most of my fears lay. And I figured, let's see what happens. If I go into labor on my own, maybe everything will be different. So that was kind of where we settled. And I think I really knew that I was but at a certain
Who wanted it on the table so that as like a security that,
yeah,
like, if you didn't feel comfortable, that you could have that to lay back on. But I think your gut the whole time really was pushing you towards.
definitely by halfway through, I think I really knew I was going to end up having a vaginal birth, but I didn't admit that out loud. Huh. And then towards the end, I was officially high risk. So I was being followed by MFM, but the way the MFM doctor put it, I was high risk, but there were a lot of risk factors, but we weren't super concerned about any of them in my case. So I have rheumatoid arthritis, which I didn't have when I had my first. I was on a number of medications and, some other things hypothyroidism that acts up in pregnancy. There were enough things on the table that, an ultrasound of month is indicated. Let's make sure the baby's growing well. But my first baby was 8 pounds, 10 ounces at 41 weeks. So he said, even if all these things affect birth weight, you have 3 pounds to play around with. That's still healthy. So nobody was really very concerned, but I did have a good amount of monitoring. So I last saw them at, I think, 32 weeks, and he said everything's good. And then I had a 36-week ultrasound at my doctor to kind of make sure everything was still good. And I know how you and some of the doula community feel about those, but again, that's not me. I want the monitoring. I want the information. And I'm never going to be the person, if I had an intervention that turned out to not be 100% necessary, I'm not going to be the person who regrets that. If the out is what we wanted and I agreed with the reasons for it, then I'm not going to have regrets about that. So 36 weeks, she was measuring big as we suspected compared to my first, and my fluid was low, on the low side, which happened with my first also. So I asked for another one because I didn't want to go till 41 weeks if I was going to have a 10-pound baby. So at 39 weeks, I came in on a Monday and I had an ultrasound. And again, the fluid was much lower. And it took like 28.5 minutes for her to get through the biophysical profile to do all the movement. And that was really unusual. She was very active. So that really didn't sit right with me. And I was feeling decreased movement also. And, my doctor said a pass is a pass. So it's okay. But if you don't feel right, it's safe to do an induction at this point. So we agreed on that. And the hospital said, tough luck. We don't have anything available for another 10 days. So I did not get a scheduled induction at that point. And then, so that was Monday. And I had an appointment on the calendar on Wednesday that we were going to cancel. But after that appointment, can I just come back on Wednesday? Can we check on the baby again? Like, it just doesn't feel right to me. So again, it took the full 29 minutes for her to, do all the movement things she's supposed to be. And I just didn't, I wasn't comfortable with that. And she said, you know what? Technically a pass is a pass, but if you're not comfortable, we trust your gut. Let's get you on the fetal monitor. And she was having fetal cells. So from there, they said, okay, at this point, the hospital doesn't get to say no. So I went straight from their office to the hospital. It wasn't an emergent induction or anything, but it was just, I'm not leaving
Medically
without one.
indicated.
Yes.
Yeah. And how far along were you at this point then?
39 plus 4.
Okay.
And to be honest, I had packed my 7-year-old's overnight bag that morning. My birth bag was 3/4 packed at that point. I was not surprised. And there's that little question in my mind. Was it an emergency or was she making it happen because she knew that's what I needed?
Get this baby out. Okay.
I don't think she made anything up. I think the risks were real, but I think if I had said, I desperately do not want an induction, can you monitor me for longer? Can I come back in tomorrow? I think she would have been willing to have that conversation with me.
Yeah.
But
She was also kind of upset that the hospital was putting us 10 days out.
right. She was not happy about that. So I didn't feel pressure. I didn't feel like the sense of urgency that I'm killing my baby if I don't drive straight to the hospital. I didn't
It
feel
was
any
your
of those
choice.
things. It was
Yeah.
my choice. We just didn't need to have the conversation because we were on the same page.
Yeah.
So I went to the hospital from there. And so I had a vaginal exam or a cervical check that morning in the office because we were going to try stripping membranes, which she did, but it ends up being irrelevant. So I knew I was at a 3. So I got to triage and they didn't even ask me for another cervical check, which to be honest was one of the things I was scared about, I guess. I've done this before, right? I had a baby before. I wasn't scared of cervical exam. Felt badly about not being able to refuse things. And I know you can refuse anything, but also if you say no and then they leave you in triage for 12 hours, I didn't feel like there were good
You
options
didn't want
to
to have
refuse
to
that
kind
one.
of create an unpleasant.
Exactly.
Yeah.
So it
I
just,
know what you mean, like that desire for harmony and peace and not upsetting people.
I
Yeah.
mean, it's like I think if you're a tough patient and you're not necessarily getting your wish, which is like better care, usually you create this weird environment of a crazy person in room 2. You don't want to be
right.
contrarian to what they want you to do, but
I just wanted the power to say no, and then I would have said yes. And I didn't feel like I had the power to say no going in, but then they didn't even ask me. She's just like, well, if you were a 3 this morning, then we already know we're not doing cervical ripening, so it doesn't change the plan. I was the nurse. It didn't even get to the doctor.
I think that's also the difference in hospital, right?
Yes, vastly different. So I asked for wireless monitor, tub room, and a trauma-informed nurse. Of those 3 things, I got wireless monitoring. The tub room was not available, and the first nurse we were assigned wasn't the best fit. I will say she was still better than every single nurse I encountered at my first birth.
She was also a very good nurse.
Yes, and she was really friendly and really nice, but she very clearly had in her mind what she felt was safe and what was right. So, for example, my doctor and I had, again, we talked about every detail. So I knew she was comfortable with me eating. We had talked, she said,
sandwiches.
Well, yeah. She said, if things go wrong and it looks like you're going to need a C-section, that's when I would ask you to stop eating. Epidural, I don't care. At that point, it's just point. And that felt really reasonable to me. I was very comfortable with that. And actually, when we did the hospital tour, the nurse who was giving the tour, she was able to pinpoint who our doctor was based on what I said about eating. She said, "That's Dr. Rouse." I've had discussions with her, and that's why I'm comfortable with it now. So this nurse she was very clearly not like,
Cool.
yeah. And she's like, well, that's what your doctor's comfortable with. What are you comfortable with? And technically it's up to anesthesia. I'm like, well, yeah, but I'm not an anesthesia patient right now. I don't have an epidural. So she's like, okay, fine. I'll get you a menu. And I didn't need a menu. We keep kosher. He brought me food. And yes, I did have a fried fish sandwich. It was one of the best things I've ever eaten. But from that point, I just ate until I didn't want to anymore. And it was great. And like other things, like she said, well, if they're going to break your water, if you're going to get an epidural anyway, you want to get it before they break your water. And I said, I don't really think I want to do that. I think I'll just ask for the epidural when I want it. And then when the new nurse came in for like handoff, she said that again. She said, we talked about that she's going to want to get the epidural before they break her water. So it wasn't a problem because the new nurse was wonderful. And we only had her for like 4 hours. That's why we didn't bother asking.
It was right on the line of like, I think also because we had such a good thing going with us, but like that nurse at that time didn't really matter that much.
That wasn't an active labor yet.
Yeah. I think if you were, maybe we would have, requested a different nurse. It was like right on the line of like, we'll just get through this nurse and
we'll get
make sure
somebody
that the
new.
next nurse
Yeah.
is definitely more in line. And
Yeah.
and the next nurse was.
She was amazing.
However,
in the morning, we'll get there, but I was basically pushing at change of shift. The nurse from the night before, she like comes right in my face, tries to give me a hug while I'm like pushing. And then I was like, whatever, it's fine. We're basically done here. And then everyone else, like my doctor, the nurse we had the night before, they're like, no, it's handled already. And she was gone and she didn't come back.
I spoke to the nurse during handoff and I said, please make sure we get a different nurse.
Right, we did. Right. And she had handpicked somebody for us.
Yeah.
And then I guess she just saw we were still
The
there
other
and
one
was just
wanted to
coming
come
right
in
back.
Yeah, okay. That just
She's like, oh, this is my patient.
out.
She just went right in and just like, I guess didn't even go to like check with who her patient would be.
Oh.
She just assumed because she had us the night before that she would have us.
And like she was friendly. She sat in the room with us for 2 hours. We were just like talking about some of our like Jewish traditions and like she was asking us questions and I was hardly in labor at that point. So it was fine. We can be friends. We can chat. I just didn't want her there when.
And our third nurse was also awesome.
Yeah, I hardly remember her because. Anyway, so fine. So the first nurse left. The next nurse came. She was amazing. She pretty much left us alone, but like she offered stuff. Like when I didn't really want to walk much, she brought me the peanut ball. I ended up hurting my hip, so I didn't use it. But she was kind of just there whenever we needed something and was very like, I explained to her, and I had right at the top of my birth plan, consent is very important to me. And I explained to her, I'm like, I really don't care if you take my blood pressure without asking me, but I need to know if anything important I need to be part of. And I trusted her enough to tell her that at that point. With the first nurse, I would not have given her that, freedom. I had a migraine, and after the oral meds didn't really work, so they gave me the cocktail that includes Benadryl. So she pushed the Benadryl. We took a little walk in the hall, and by the time we get back to the room, my words were slurring. So I went to sleep. At some point before that, I think I had asked for another cervical check. There hadn't been much progress made. And then I think it was around 1 a.m. I was maxed out on Pitocin. So she came in and she said, how would you feel about having your water broken or allowing us to break your waters? Now, on my birth plan, I had put that I don't want my water broken. But to be honest, at that point, I didn't care anymore. I was perfectly comfortable with doing something to move things along. And it was my choice. So they had a hospitalist midwife come in and she broke my water. And I think at that point I was at like a 4.5. So not a ton of progress had been made until that point. And then I think one other cervical check sometime a couple hours later. So I was on Benadryl. I think I had an epidural already. And he asks me, do you want to be checked? And I said, no, like, I know I'm not ready to push. And then the nurse comes back in and she says, so your contractions are coming 1 minute apart. And I said, oh, okay, I understand. Sure. I had made the connection. Essentially, we came in for fetal distress, and if my contractions are 1 minute apart, there's a reasonable concern for fetal distress. If I'm a 9, it's a very different situation than if I'm still a 5, and they would be dealt with differently. So there's an important reason to have that information. So she checked me, and I don't even remember what the answer was. Was it at that point? Oh, I don't
You were
remember
10
that, but
centimeters.
I feel like I would have.
When it was time, I was like, let's.
No, but that wasn't that. That was later. That was
In the morning.
sometime while I was still sleeping. So I don't remember what I was at. But regardless, there was no fetal distress, so that was fine.
I know we went from like there was like very minimal progress.
So I woke up around 6, I think.
Yeah.
Or maybe 6:30, and I said, "Pretty sure I'm complete. Can someone check me, please?" And it was like a 2-second check. Yep, cervix is gone. So that was around 6:30, I think. But anyway, after they broke my water, pretty much immediately I asked for that epidural. I had it within 20 minutes, I'd say. And that was great. It was different than my first. My first, I really couldn't feel anything. This time, it got rid of my contractions, but when it was time to push, I felt everything. I could move my legs. Turns out it really just wasn't working much for me down there. My doctor thinks maybe I felt 50%. Maybe she's right. Maybe I felt everything. I've never done it with no pain relief, so I don't know. But I definitely felt everything when I was pushing. And from that point, so I said, oh, I was complete. Called her. She came. She specialed me. She wasn't on call. I didn't know that until I asked the nurse how many other patients she has. And she said she is just coming in for me.
Oh.
I think it's one of like the it's like almost like ironic that on your second birth you felt like infinitely more physical pain.
Yes. Yeah.
And yet this one was, we would consider minimally or non-traumatic.
Yes, non-traumatic at all.
And the first one you felt zero pain,
right.
But it was horrifically traumatic and caused years of fallout.
Yeah. Yep. Yeah. Definitely.
Which is obviously because it's about your autonomy and
Right.
you feeling
and
being
severe pain can cause trauma, but it doesn't always. It depends on how well supported you are in some cases, right?
Yeah. So okay, so I started pushing, and I had like all these things in my birth plan of like, in my mind I was very flexible about it. Like I didn't know what I would want to do in the moment, but I wanted the option to push in different positions, to whatever. Turned out I was perfectly comfortable reclined. I was not placed in stirrups, pushing my feet against them. They left the bed whole until it was clear that I wasn't using it and I wasn't planning to use it, so then they broke it down. But like at no point did I feel like this is what I was supposed to do. It's just
You were
what
just doing what
was
felt
working
good.
for me. Yeah, and I started off like, trying like the breathing that I had learned, and nothing was really happening, and like turned out I just wanted the baby out. So then I switched to like the more like the Valsalva pushing, and that worked for me. I had a mirror in the ceiling, which I think was so cool. It was, you couldn't see it unless you wanted to, so they would angle it towards you. So when I said I wanted the mirror, they're like, oh, it's right there whenever you want it. So they just like used the remote to angle it until I said I could see it, and then they left it there. That was really helpful. With my first, I was the only person in the whole room who could see what was going on. Like, I don't know, I guess I was draped or whatever, and I had belly, I suppose, but I really felt like it was something that happened to me. And one of my number one goals was not to feel that way again. To feel like I was present the whole time, and it was something that I did. And that's really what happened. Like I said, I'm kind of an information junkie, so I've learned a lot about trauma and how things like what the tools are to not experience those things, but also even when I know everything, I can't always stop my body from feeling that way. So I've had dissociative experiences before where I knew what was happening, but I couldn't stop it. So he was prepared to step in if needed. But my doctor really just handled it all. And I didn't have that specific conversation with her, but she just kept referring back to like, remember this conversation we had? That's what's happening now. And like, she kind of kept me informed about what was going on. At one point, she even said, "You see how the head is there, and it kind of just stretching." It was really painful at that point. And
ring of fire, right?
yeah, I definitely felt that. I had him push the button for the epidural. It didn't work. She injected some local anesthetic. I don't think it helped at all, or maybe it would have been much worse. And she said, "This point right here, this is where some of my old partners would get out of me. It's not because they're trying to hurt. They feel like if they just give you a cut, the baby's out. But evidence does not show that. Does not support that. So, but like I don't know if everybody would have appreciated that while they're pushing, but that's what I needed.
She was also saying, like, for recovery and all that, like, the best way to push and when to hold and when not to push. And
Yeah.
it was just a very,
Right. She helped me. She did. Right. And we had talked about this before. She said, "You can do whatever you want." There are things that I feel like I can do to help. If she's like, "You want to push on your hands and knees, you can push on your hands and knees. You want to push however you want, you can." There's not much I can do to protect your perineum in some of those positions. If that's what you want to do, that's fine. If you want to, so I kind of went along with her, and I didn't have the urge to get on my hands and knees, so I didn't. And she supported the perineum. I think she did some perineal massage, but then when I didn't want her to do that, she didn't. And whatever she did, or however she coached me, she's like, "I'm going to ask you," and she told me this beforehand, that I'm going to ask you to slow it down when her head is there. We want that stretching to happen. She did all of those things, and I had a 1st-degree tear and 1 stitch. So whatever she did worked. I listened to your whole series when I was pregnant on protecting the perineum, and my main takeaway, you can correct me if I'm wrong, but my main takeaway was doctors who are scissor happy need something to do with their hands. Doctors or midwives who have actual skills, there are things that they can do, but there's not solid data each of those things, because it really just comes down to skill level and training. I don't know if that's what all the data said, but that was my takeaway.
Providers have much higher severe tear rates than others. And
right. So I didn't ask her for her rates, but she was very comfortable in this area. And what I really believe, that if she had been my doctor with my first, not only would I not have had an episiotomy, but I don't know that I would have had the nerve damage, because she would have
probably not. Yeah.
Oh, and this baby came out sunny side up, which is the biggest joke of all, because it was such a non-issue that I didn't even know until she was out. And they're like, "Oh, there's her face." Whereas with my first doctor, that would have been a C-section. So I was pushing for probably 40-ish minutes, so longer, but she was sunny side up, still not very long. And I just find that so funny that it was
That was kind of
just
start
so
of both of your
unimportant.
stories. Yeah.
Yes.
well, then
The fear of
also,
My first flipped, she wasn't sunny side up. My second
Right.
was.
once she came out, she was on you. I think it was less than a second. It was like baby was out, and it was probably 2 seconds until she was on your chest.
Yeah, but
Still commented, still everything.
yeah, so her head comes out. I think my doctor immediately turns her, and she's out the rest of the way. And she said, "Okay, grab her," and that was it. So I did, and she's like, "Hey, just go slow," because she's still attached to the cord. But I picked her up, and I brought her up to me. There wasn't even any they placed the baby on me. I didn't pull her out of me, but I picked her up immediately, and then she was just there. And then I think I remember
left. She's still there.
Pretty much. Then I remember the nursery nurses, I think they were doing some stimming, and I guess they came to my shoulder and was doing APGARs and stuff. That was it. Nobody touched her for an hour and a half. And then at a certain point, they took her, they weighed her, they did all the stuff while I got up and went to the bathroom and did the checklist they needed to do to get out of recovery. But I remember even earlier on, I said, I'm kind of curious about her weight. And they're like, "Just leave her. We don't need that right now. Let her get that time." So that was really their focus. And I think that's something that I was so nervous about, because I chose my doctor, I chose the hospital, but you only have so much in choosing your nurse. Not somebody you can interview. Yeah, you can fire somebody, as we sort of did. But yeah, so I was very nervous about that. But it's clear that that hospital is set up in a way that if I have another baby there and I don't have as good an experience, I think we'll just know how to switch. Like, we know that you can get that. So if the nurse that we have isn't supportive of that, so we get a different nurse, because clearly that's possible there. So I really felt like, to borrow from the class, I really felt like we had the golden ticket experience. I did a ton of prep, but if had I done less prep, I still would have had a good experience.
Yeah, it did sound to me, especially in describing your OB, that you had the golden ticket. So that's incredible. And I want to know, what were your feelings after the baby came out and you were, recovering from that? Like, what thoughts were going through your head?
I mean, honestly, I felt like a badass. Like, I did that. I felt so powerful that, like, that was something that I did. The whole time I felt like I was the center of the room versus like an afterthought who happened to be delivering a baby. Yeah, I mean, and she was with me the whole time. I remember saying, like, that's a real baby. Like, that's a whole different baby. She looked exactly like my first. Exactly, which was crazy. I knew I was
First thought was like,
baby.
we've seen it, like
I had that baby already. So that took some processing. But they're very different people now, even with the baby only being 7 months old. They're completely different. Yeah, and I just really felt so powerful and, like, so almost like high on birth, which isn't something I felt before. During my pregnancy, I listened to a lot of your, like, issue podcasts, like talking about the evidence on, anything I was interested in, I would listen to that episode. But I think I've listened to every single birth story since.
Wow.
It's still something I still like to listen to birth stories. And to the point where if, we have another baby, like, now I would maybe take a hypnobirthing class or something like that. I'm still not one to say I don't want an epidural. I need it to be natural. I don't really feel that way, but I would like other options available to me if that's what I want at the time. I can understand the appeal for other people. People go in just wanting natural birth and wanting no interventions and, all that. I can understand the appeal, and I really didn't feel that way before.
Stephen, what about you? What were your feelings afterwards?
it really was, like Rivka said, it was like a high. I mean, it was like a really, it was just very, like, meaningful. We really felt like we went through, at least I did, I don't know. Felt like we went through it together. And, like, I also, differently than the first time, felt like a part of the process. I was helping her. Well, I mean, obviously I was not a very major part and I didn't do a lot of work, but I definitely felt, involved and, and a part of it. And, I was definitely a little bit more closer to the action zone than I was on the first time. And, I mean, it really was a high. And it was like, we were high for, like, hours after, of just this, like, euphoria after she came out. And then we didn't sleep for a couple weeks. That quickly dissipated, but it was a very, just like with the doc, like, just that it was like the three of us in it, it was like a really, it was an incredible experience.
Oh, and my nurse stayed, the one from the night. It was change of shift. She moms take her kids to school so she could stay through my delivery.
Wow.
And then she left right away, and the other nurse, like, recovered with me. But
Well, she stayed, made sure the next nurse didn't come in, and
right.
Yeah.
And she stayed until our baby was born.
It sounds like I imagine it wasn't just like a magical experience for you and your
I mean, it
family,
really
but also
was.
for everyone in the room,
Yeah, I hear.
Yeah.
Yeah, I hear that.
I mean, it's
Probably.
a hard profession, obstetrics, nursing, and to have a birth like that you can tell is healing and has so much positive energy that has to keep them
we
going.
felt very special. I mean, the doctor came in on her off night. I mean, how many
Yeah.
doctors are going to do? I mean, these doctors work hard enough, and
And there's only 2 of them, so they're on call a lot.
Yeah.
And she came in the next day when she came in to round on us. She said she remembered, like, how I looked the first time I saw her, probably 2 years before I was pregnant. And she's like, I just knew I could make it different for you. And she,
Yeah.
like, held on to that, and then she really did. And I really spent most of my pregnancy being scared of birth. And now, like, I don't feel that way at all.
One last question before we have to go. Do you have any advice for parents who might be seeking trauma-informed care like you were?
Yes. don't be scared to interview doctors. Like, I don't know if you need to be as obsessive as me, but it was really helpful that I did it when I was not pregnant. I did it with birth in mind. So I asked them the questions of this is what I think my needs are. And I kind of listened to how they answered. And I got the yeses from everybody, but they came differently from
And probably we're
different
looking at
providers.
body language and other cues as
There
well.
was one doctor who I actually liked him, but when I asked him about like some of the things I asked him about, he kind of laid the foundation in a way that like I asked about arm restraints for C-section, and he said something like, oh, I mean, like the arm boards have to be there, your hands have to have somewhere to go, but like he kind of just said it that way, and it took me a while to connect that the way he answered the questions meant I wasn't going to get the things that I felt I needed, and I did not use him. So yes, so all of that really helped. Knowing in advance, because once you're pregnant and you go to the doctor, it's a big deal to switch to somebody else, even though it can be done. But what if you don't like the somebody else? So yeah, so that I think is my biggest thing, was finding a place I felt safe before I got pregnant, if you have that luxury. And my birth plan, I was pretty detailed, but next time I would really shorten it to consent in bold letters. I mean, or just, explain I have a history of trauma. Consent is really important to me.
You wouldn't write a 2-page letter, single space with.
Okay, it was bullet points. But yes, I did have a very detailed birth plan, and I would take most of it off next time. And the number one thing that they need to know is, before you do anything, touch me, touch my meds, do anything, you need to talk to me, and there needs to be a conversation. And then the way my doctors put it, I think, is advice that will help everybody. She said, you will know if I feel really strongly about something. Other than that, there's almost always time to have a conversation. And to that point, I had uterine atony, is it called? And it was such a non-issue. Like, she had a second to tell me what was going on and what she wanted to do about it. And I am never going to be the person to say, don't stop me from bleeding out. I was comfortable with everything she wanted to do, but I felt no stress about it. I was not worried. There was no anxiety in the room. She told me what was going on, how she wanted to address it, and then she did. So I knew that something needed to be done, and then she did it. And there was no problem and no trauma from that.
Mm-hmm. Makes sense. Well, Rivka and Stephen, thank you so much for sharing your story. It was really inspirational for me to hear, and congrats on your newest child. And I'm just so happy that you were able to get a healing experience that left you both feeling more empowered as parents.
Yeah. Thank you so much for having me.
Thank you for, all the work that you do. And I think you were, without knowing it, a part of our journey, and thank you for the good work, keep it up, because you're changing lives.
Thank you. Today's podcast was brought to you by the signature articles at Evidence-Based Birth. Did you know that we have more than 20 peer-reviewed articles summarizing the evidence on childbirth topics available for free at evidencebasedbirth.com? It takes 6 to 9 months on average for our research team to write an article from start to finish, and we then make those articles freely available to the public on our blog. Check out our topics ranging from advanced maternal age to circumcision, due dates, big babies, Pitocin, vitamin K, and more. Our mission is to get research evidence on childbirth into the hands of families and communities around the world. Just go to evidencebasedbirth.com, click on blog, and click on the filter to look at just the EBB signature articles.